Let's practice somatic tracking today. I will demonstrate how you can do this mind-body exercise. At the end of this video, I'll tell you the explanation why this type of exercise works for people with chronic pain, especially for people who have nociplastic pain, central sensitization, or chronic primary pain. So let's start. You can do this in any position. Sit comfortably or lie down. You can even do this while moving your body. It is okay to leave your eyes open, but if you prefer, you can close your eyes. Now, I want you to notice your sensations. If there is a sensation that you describe as pain, I want you to watch this sensation as an observer. Imagine you are outside of your body. Notice the sensation with curiosity. Like if you were looking at a painting, looking at the clouds in the sky, or watching fireworks. How would you describe this sensation? Is it dull, hot, sharp, squeezing? Is it pulsing? Is it changing? You don't need to pay attention to every detail with precision. You don't need to give an accurate description. Like watching the clouds in the sky. You may use your imagination to describe this sensation. Now, it is important to remember that you are safe. This is just a sensation. You are not in danger. If your doctor told you that you have a primary chronic pain, that this pain is coming from a sensitized pain system, that you have muscle tension, then what you are feeling is a sensation, but it's not a sign of anything dangerous going on in your body. There is nothing broken, damaged, or misaligned. Now, I want you to notice the size of the sensation. If the sensation is taking a large part of your body or a small area, is it changing in size, shrinking, or spreading? Is it increasing, decreasing? Notice where this is in your body. Notice with curiosity. Do not overthink. Do not analyze or explain the pain. Just notice it. If you start getting anxious or the pain is increasing, I want you to shift your focus to your breath. Notice your breath. The air entering your nose, feeling your chest. Is it warm, smooth? It's just a sensation, a neutral sensation. Breathing is not harmful. It's not dangerous. You don't need to be fearful of breathing. It is just a sensation, like any other sensation. Check in with your pain sensation. You don't need to try to eliminate any sensation. You need just to feel it and realize it is safe. You are safe. You're not in danger. Like looking at the clouds, just notice them. Describe what you see without judging as good or bad. Looking at the clouds is a neutral sensation. Now, just notice your body sensations. Describe them without judging. They are not good or bad. They are just sensations. They are neutral. Your brain is misinterpreting sensations from your body as dangerous. Breathe slowly. Remind yourself that there is no harm in your body. Do you notice if the sensations move from one part of your body to another? Or does it change size, decreasing, increasing? It doesn't matter how this pain sensation behaves because you know it's not dangerous. You have been given green light to move this body part. You're not damaging this part if you use it. Actually, it is the opposite. If you don't move it, you will get worse because your muscles are becoming tight, and you're not lubricating your joints. Remember, motion is lotion. Your brain has been trained to think this sensation is dangerous. And how does it communicate it's dangerous? It's by creating pain. But now you know there is no danger there. You have been reassured that your body is okay. You are safe. You are not broken or damaged. If you had your eyes closed, you can open them now. That's it. Easy, quick, you can do anywhere. Now let me explain to you what was happening in your body when you were doing this somatic tracking exercise. But before I continue, let me remind you that this video is not medical advice. You need to get a diagnosis from your doctor or therapist. If you have any emergency, go to the nearest emergency department or call an ambulance. And this video is just for educational purposes only. First, you are retraining your brain. You are creating new synapses in your pain system. This is called neuroplasticity. The same way that the pain synapses were created, you can undo them by doing this exercise of somatic tracking. Second reason, did you know that there are 3 components of somatic tracking? The first one is mindfulness. You need to pay attention to what's happening at the moment without judging it. The main key word here is curiosity. Observe, notice, look around. The second component is safety reappraisal, which means to reappraise the situation by sending messages of safety to your brain. If you had pain for a long time, your brain believes that you are in danger, that there is still something broken, damaged, or injured in your body. And reappraisal means a shift in the way you see the origins of your pain. The third mechanism is the positive affect induction, which means you can feel lighter by sending some positive messages to your body. This could be using humor, jokes, visualizations, breathing, sending love to your painful sensations. Treating the painful sensations with tender, loving care, or TLC, right? Third, this is a form of exposure therapy. Have you heard of people who have phobias? Some people are afraid of spiders. And how do you remove their fear of spiders? It's by exposing them to spiders. First showing pictures of tiny spiders, then showing real spiders, and then learn that the spider is a tiny animal that is not dangerous to them. Well, I know. There are some real tarantulas or other Venus spiders, but the idea here is that the tiny house spiders are really not dangerous. Some people have fear of speaking in public. This is called stage fright. And this kind of fear can really impact their careers, advancement, profession. For example, some people do not accept promotion at work because they are afraid that they will need to speak to a classroom or to teach their colleagues at work. So they need exposure therapy. Somatic tracking is a kind of exposure therapy. You're exposing your mind to the pain sensation, but noticing them as just a natural sensation and turning down the danger signals that are commonly associated with pain. The main goal of somatic tracking is not to get rid of pain. The main goal is to learn how to feel safe in the presence of pain. There is no pressure to reduce pain. Well, the fourth mechanism, the goal of somatic tracking is also to cut the fuel of pain. Do you know what is the fuel of pain? It is fear. That's why somatic tracking works. Because if you feel safe in the presence of the sensation of pain, then your brain does not need to amplify the pain sensation. If you do not see this chronic pain that you have as a dangerous situation, then your brain will decrease the pain automatically. The brain keeps maintaining the chronic primary pain because it thinks you're in danger and you are not taking action to eliminate the danger. Once the brain sees that you are safe, it will turn down the pain alarm. The main problem is that I see people doing somatic tracking is that they think this is a way of decreasing the pain intensity. No, it's not. It will only decrease the pain if you are able to cut the fuel of pain. So keep practicing somatic tracking until you feel safe in the presence of pain. Fifth, another goal of somatic tracking is to lose the fear of movement. Many people are afraid of moving because they had setbacks or flare-ups when they try to exercise. Try to practice somatic tracking while doing movements that would cause a setback. This is a good opportunity for you to do it. And while doing those movements, keep sending messages of safety to your brain. Notice the movements with curiosity. Observe what happens. You are not in danger. It's safe. Even if your brain responds with more pain, remember, the pain is not a reflection of how much danger is in your body. In your case, hurt does not mean harm. Many years ago, I had a patient that had chronic knee pain, and she thought her pain was caused by osteoarthritis. All the doctors who saw her x-rays and MRIs of her knee told her that she needed a knee replacement. She came to me to see if there was anything I could do for her. Well, when I examined her knee. I saw that there was some osteoarthritis, but she had excellent function, range of motion, and most of her pain was not due to the osteoarthritis, but from the muscle tension around the knee area. I told her that her brain was sensitized and she needed to retrain and walk more, not less. She didn't believe me. Then I asked her this question. When you go on vacation to your country, is your pain worse or better? She told me that when she's on holidays with her family, she barely feels the knee pain. She walks more, visiting friends, and she doesn't even need to take her painkillers. I asked her, did you leave your osteoarthritis here or did you bring these knees with you? She laughed, but she realized that she still had osteoarthritis when she was on holidays. But her brain was able to shut down the pain sensations. So, with this knowledge, we started a program for her that she trained her mind and body that her pain was not caused by osteoarthritis, that in fact, her brain was able to cancel the pain alarm. Guess what? She didn't need a knee replacement, and she's now doing aqua therapy 5 days a week and feeling a lot better. Now, here are some tips for you when you practice somatic tracking. Tip number 1, ask your doctor or therapist if brain retraining techniques like somatic tracking is a good technique for you to do. Remember, not all chronic pains are nociplastic or primary pain. If you have a chronic pain that is nociceptive or neuropathic pain, then your pain is a signal that there is some danger in your body that you need to tend to the sensation seriously. Tip number 2, do not do somatic tracking to reduce the pain intensity. Use somatic tracking to feel safe in the presence of pain. Tip number 3, if you are not feeling pain, then you do not need to do somatic tracking. Just go and enjoy your life. Wait until your pain comes back and then use that period as an opportunity to retrain your brain. Tip number 4, do not try to do somatic tracking if your pain is at a very high intensity. It will be really hard for you to feel safe if your pain is very intense. Try to do somatic tracking when your pain is at a mild to moderate intensity. Tip number 5, if your pain is intense, use some of the other tools you have in your toolbox to lower the intensity of your pain. Tip number 6, try different ways of doing this exercise. It is a mind-body retraining. The more you practice, the better you get at it. Remember, you are undoing synapses. You are retraining your pain and desensitizing your pain system. Do you remember the analogy that I always use to explain nociplastic pain? I explained that pain is like the alarm system of the body and like the alarm system of the house. Nociplastic pain means that the alarm is going off, making loud noise all the time, but there is no fire, no smoke, no burglar. It is just a false alarm. So you call the alarm company and they will regulate the alarm system of your house. This is exactly what you are doing to your alarm system. You are regulating it. Lastly, we don't want to shut down the pain alarm system because you need it to survive. But we want the pain alarm system of your body to react when there is a danger, not when you are safe. In other words, Alan Gordon said this: in order to get rid of chronic nociplastic pain, all you have to do is change your understanding of what the actual sensation is. Well, visit my website, www.drandreafurlan.com, to get more information about chronic pain. I have many resources that you can download if you have chronic pain. And I offer online courses for healthcare professionals who want to learn more about how to treat people with chronic pain. Thank you for watching today. Goodbye.